Welcome back inside the Now Morning Show. Hope you're feeling all right this morning. We're going to have a conversation right now about the importance of breastfeeding. And to do that, I want to welcome Patrice Benjamin Small, who's a registered nurse, a licensed midwife, and a BFHI trainer, as well as Elka Thorne Brown, who's a program manager at the same BFHI. Good morning to you, ladies. Welcome to the Now Morning Show.
Good morning.
Thank you so much for joining us this morning. Firstly, let me get into Elka. Let me start with you. Can you give us a quick introduction as to what the Baby Friendly Hospital Initiative is all about?
Okay, so the Baby Friendly Hospital Initiative is a global initiative which was launched by the World Health Organization and UNICEF way back in 1991. And this was launched in efforts to reduce the numerous amounts of babies who suffer from malnutrition, premature deaths, and poor infant feeding practices throughout the world.
Okay.
Part of the initiative is to implement the 10 steps to successful breastfeeding.
Mm-hmm.
And that includes antenatal preparation for breastfeeding, care after birth, which includes skin to skin contact, rooming in, as well as support for the mothers after they are discharged, just to name a few of the 10 steps.
All right, fantastic. And I understand that there's accreditation available at the Point Fortin Hospital for the same BFHI?
Yes, so the Point Fortin Hospital recently received their global award of the Baby Friendly Hospital Initiative accreditation from PAHO. That was in June 2024. And
Nice.
we recently celebrated it officially last
Tell the nation what that means. What does that accreditation actually mean for the Point Fortin Hospital?
So what it means is that the Point Fortin Hospital actually practices the 10 steps to successful breastfeeding together with including respectful maternity and newborn care services, as well as support for the HIV positive mothers as well with their infant feeding practices.
Nice, fantastic. All right, let me jump across to Patrice Benjamin Small, because I want to get into some of the important, the important factors when it comes to breastfeeding, some of the benefits to both the mother and the baby.
Sure. So for the mother, I will always say the first on the list, breastfeeding is free and convenient, right? It has a lot of benefits for the mother. Also, it allows for bonding, which is very important.
Mm-hmm.
And as Nurse Brown said, skin to skin benefits also helps with the bonding process. And for the baby, again, bonding. And it helps with the immunity and it helps prevent non-communicable diseases like kidney problems, diabetes, hypertension. We see a lot of that trending now in our children. So the benefits of breastfeeding helps to prevent those non-communicable diseases.
Now, I always hear, I mean, when I became a father, I heard about this colostrum thing. And I understand that that is where the benefits actually come from, the same benefits you're talking about. Tell me a little bit more about colostrum.
Okay, so after delivery, colostrum is the first milk or liquid that comes, right? And what that does, as I always say, is like a coating on a wall or a painting on the wall. Colostrum goes in the stomach and coats the baby's stomach. So any virus or bacteria that may enter the stomach, it helps prevent those from occurring. So the baby will not be vomiting or any diarrhea. The stomach is coated with that nice, thick colostrum.
Fantastic.
And mothers don't need to fear if they would have colostrum when the baby is born, because colostrum is produced during pregnancy from as early as 14 to 16 weeks of pregnancy. So it's a guarantee that the baby is going to receive that first milk when they are born.
Okay. So from the time they are pregnant, the colostrum already starts manifesting. And from the time the baby is born, the first milk that they get, it's available to them.
Yes.
Fantastic.
At around the 14th week of pregnancy.
Okay, great. So tell me, Tell me, Ilka, a little bit more about the recommendations for how long we should be breastfeeding children for. I mean, I know you say it's free, but do we get enough nutrients from it that lasts how long? When should we stop breastfeeding?
Yes, so it is recommended. Universal recommendations for breastfeeding is exclusively for the first 6 months, meaning you're giving baby only breast milk for the first 6 months. There's no need to give baby any other drinks, any water, any cereal, any other foods during that first 6 months because the breast milk contains all the valuable nutrients that baby requires during that time. And following the completed first 6 months, baby is then introduced to what we call complementary foods, which are the soft pureed foods that moms could prepare. But together with that, we recommend that continued breastfeeding is going to take baby throughout till 2 years and beyond. So there's not really a cutoff age. 2 years and beyond, we say. So mom could go as long as she thinks it's feasible for both her as well as her baby. And baby continues to get a lot of the valuable nutrients together with the immune support throughout that period of time. Because when we talk about immunity, baby's immune system is not fully developed until around age 4. So continued breastfeeding is valuable to the child in preventing a lot of diseases still at that age.
So we can breastfeed until age 4
Yes,
Yes.
and beyond.
And we
and beyond. There really is no
And
cutoff
beyond.
age. Big hardback man, I think it still be. I mean, just checking to see. Very very interesting stuff, man. All right, so let's get into some of the 10 steps to breastfeeding, if you don't mind. I mean, we have a little time this morning, so let's get into some of the 10 steps. Maybe you can take half each. I don't know. Let's start with you, Alco.
Yes, that's fine. So the first five. So the first 1 and 2 steps deals with the critical management procedures. So step 1 is divided into 3 parts. We have where there should be a hospital policy at all the hospitals, and that policy guides the actions of the staff, and it also familiarizes the patients as well as their families with the practices that assist in promoting, protecting, and supporting breastfeeding. And when we look at part B, that deals with protecting breastfeeding. So that's about the International Code of Marketing of Breast Milk Substitutes. So there shouldn't be any aggressive marketing of breast milk substitutes within any health institution in the country, and particularly under the SWRHA. And part C talks about the data management and collecting systems. So, in order to identify the areas that need improvement and what actually is working well with the Baby Friendly Initiative, we would have some data collection and quality surveys that are done to determine the success as well as the failures in certain areas, and try to implement probably new practices that will assist in the sustainability of the Baby Friendly Initiative.
All right,
And
nice.
part 2 of the 10 steps, we have training. So, training is very essential
Mhm.
for this initiative to be successful because when staff are trained, they have the information, they have the competencies where they are able to assist mothers in their breastfeeding journeys from the start during the antenatal care and throughout their breastfeeding journey. Step 3 talks about the antenatal care. So, at the antenatal clinics, we give lectures, we provide information to the mothers through brochures, visual, audio information. They could even receive this information online, courtesy the Ministry of Health's database on their website and the regional health authorities' websites. They are able to access antenatal breastfeeding information through that.
Okay.
And step 4 is skin to skin contact. So that is the care right after birth. So skin to skin contact is encouraged immediately after the birth of the baby. And this is where baby's naked body is placed on mom's naked chest, and babies are allowed to remain uninterrupted for at least 60 minutes post delivery. The only times when skin-to-skin contact may be interrupted or may be delayed is if there's a medical reason, if there's urgent care for the mom or urgent care for the baby.
Right. Okay, and number 5?
Yes, that's skin-to-skin contact, as Nurse Benjamin Small would have mentioned before.
Right.
It has a lot of benefits to the baby, where it helps in them being able to be prevented from having a lot of common illnesses as they get older throughout
Right.
into their adult life. So
Yeah.
skin-to-skin contact is one of the main starts to breastfeeding.
Okay. And number 5?
And step 5 is where we would assist mothers to manage the most common difficulties that they may have with breastfeeding. So we would start with, observing a breastfeed and ensuring that the mom is positioning the baby well and the baby is latched on correctly. Because with a correct latch and correct positioning, this will determine that baby is indeed getting all the milk that they would require.
Nice. Let me jump across to Nurse Benjamin Small. Give me the other 5 steps in the 10-step program.
Okay, so step 6 deals with supplementation. And babies are only supplementing if there's a medical indication for supplementation.
Okay.
Step 7 deals with the ruminant, and that is where mothers and babies stay in the same space, or babies just in a cot next to mommy, and it moves you to step 8, whereby mummies would be able to recognize babies' feeding cues and respond accordingly, because baby will start to demonstrate some signs that will tell you, hey, mommy, I'm getting hungry. So baby start to suck on their hand, make this smacking noise, turn their head from side to side, when they call that rooting. So mommy indeed will be confident enough to take baby up and breastfeed at that time. And we have step 8, step 9, what deals with we do not allow babies to use pacifiers, nipples, teeth, because what baby does is get something called nipple confusion. When we have a baby on a nipple and then try to put the baby back onto the breast, baby gets confused. And step 10 deals with follow-up or ongoing care for the mothers, as we say, discharge follow-up for mothers after leaving the hospital. So
Fantastic.
We have follow-up WhatsApp group that we can contact the mothers, and we have ongoing follow-up clinics that mothers could come in and get any assistance that they need with breastfeeding if any challenges should arise. And they can get help at any hospital, any health center.
And that's the part I wanted to clear up, that you can come to that. They can go to any health center, any hospital, and get that support and that assistance. And is it already built into the... Is it built into the equation from the time you have that child, automatically the support kicks in?
Yes.
Yeah? All right. Just checking to make sure. And if people want to reach out to say, wait, first of all, let me find out as well. Do you know any other hospitals in Trinidad and Tobago that have that accreditation besides the Point Fortin Hospital?
Yes, the first hospital in Trinidad and Tobago to receive the accreditation was Mount Hope Women's Hospital, followed by Sangre Grande Hospital, then Point Fortin. And Tobago is just awaiting the official designation.
Fantastic. I love that. And I really love the initiative, because I think that it's important for us to understand from birth that bonding that you're talking about, because it not only helps with physical, actual wellness, but I think it also helps with mental wellness as well going forward.
Yes.
Because that sense of belonging and bonding builds that trust with the parents and, of course, with the child as well.
Yes.
So, ladies, let me say thank you so very much for joining us this morning and for sharing this information. And I want to encourage Trinidad and Tobago to reach out, especially ladies who are either recently became mothers or are on the way to becoming mothers, or even just thinking about it. They can get the information so they can understand what is necessary and what is needed. So thank you very much for joining us this morning, ladies.
You're welcome. Thanks for having us.